Yeah, hi everyone. Welcome to my YouTube channel. My name is Dr. Wan, and I am here to address the question regarding the usage of insulin. First of all, before starting the lecture, I will simply advise my followers to subscribe to my YouTube channel, like it, share the links with your loved ones as well as friends, and also ask questions as many as possible, and I will be more than happy to answer. So, here goes the question: why should insulin not be used to all patients with type 2 diabetes? I can put the question the other way around. Can all type 2 diabetes patients use insulin? The answer is somehow yes and no. So I'll explain further what is the meaning of yes and no. So I'm indirectly saying that certain group of patients can use insulin injection, some cannot. And I will go further to explain who are these group of patients who can use it and who are those who are not allowed to use insulin injection. Now, I want to first of all say something with regard to insulin that you can equally get it from plants. There's what we call Chamaechaetus caspidatus, also known as pyrrole flax. They look like cassava leaves, which we find in tropical country. Unfortunately, this plant so far, I can assure you that is found in Brazil, in Latin America. So you can equally use this one in alongside with your medication for diabetes. Like so, it will go a long way in bringing down your blood sugar level in your body. So, what is insulin? That's my first question. So, insulin is actually a hormone that the body produces, to cut the long story short. And the purpose of this hormone is to regulate your blood sugar level. That's to normalize it, bring it down to the standard value that is supposed to be. It is made by beta cells in the pancreas. Insulin's main job is to move glucose from our bloodstream into the body's cells to make energy. The next question now is, does insulin lower blood sugar? The answer is yes. Insulin lowers your blood sugar level. That one for sure is guaranteed. Glucagon, which is another hormone, naturally raises it. Your body uses these two hormones to balance out your blood sugar level to keep it in a healthy range. If you have diabetes, too much manufactured insulin can lead to low blood sugar, that is hypoglycemia. Now, how is this insulin produced? Like I said before, insulin is a hormone produced in the pancreas by special cells called the beta cells. The pancreas is below and behind the stomach. Insulin is needed to move glucose into the cell. Now, coming back to the question which I posed before, that who are the class of patients who are allowed to take insulin injection? There are just two here. So the first one are gestational patients, or what we call gestational diabetes. So if you are pregnant and your blood sugar is spiking, in that case, you need to take insulin injection, which is logical. It helps to bring down your blood sugar level to normal. Another group of patients are those who have very high value of insulin sugar in the blood, which we call it hyperglycemia. If you are hyperglycemic, in that case, you need insulin injection because our target is to bring it down to normal. So if you go back home from hospital, or say your blood sugar level is being brought down to a reasonable value, say 7 millimeters of mercury in decimeter, then in that case, you don't really need to. We know that you are a diabetic patient, but you don't need to be taking insulin injection because it has what we call a counter effect. That is, there are high chances that you could develop what we call insulin resistance down the road because of weight gain. So that's the reason why I do not recommend patients with type 2 diabetes to keep taking insulin injection unnecessarily. So once again, only a healthcare professional can recommend it. Otherwise, everybody with type 2 diabetes should only stay on tablets. And the classical tablet here is metformin. Metformin is good because it has a neutral effect, though there are some side effects like vitamin B12, which plummets at a certain point. When you use it for a longer period of time, for sure that would happen. There are also other group of medication that you cannot use as well because they also involve in the weight gains, like the piotiazones. Those ones are not good for you to use. I will send a list of all this on this my video for you to get hands on so that you know which diabetic drug to avoid when it comes to weight management. So far, so good. I think I've answered this question now because I've had a lot of questions, a lot of concerns from people who are already using insulin without being instructed properly. So that's why I'm here to clarify this. Again, do not take insulin if you are not recommended by a specialist, that is an endocrinologist. And the only way to get usage of this drug is by going through a specialist, not a GP. And like I said, there are just two classes of patients. Those who are pregnant, say the ladies, what we call gestational diabetes, you can take it. And the other class are those who have very high blood sugar value, what we say hyperglycemia. So those are the two classes of patients that are allowed to take insulin injection. For all others who are diabetes type 2 patients, I will say no. Once your sugar value is being stabilized, you remain on medication. Once more, thank you for listening, and I wish you a wonderful evening. I'm Dr. Wan. Have a nice day. Ciao.